Hello, this is Dr. Sam, your online doctor. Let me use this period to talk about the causes of pain in the abdomen. You may be a patient may ask, doctor, what's the cause of my pain? So, and the pain could be an abdominal. If the pain is an abdominal pain, at least this talk I want to give now will help answer the question. The pains in the abdomen, pain in the abdomen can come from any of the tissues in the abdomen. It will come from visceral organs inside the abdomen. It will come from bones, like the spinal part of the spinal cord that passes through the back. It will come from intestines. It will come from the kidneys. It will come from the gallbladder. It will come from the stomach. It will come from the ovaries. It will come from the uterus. It will come from the fallopian tubes. It will come from the appendix. It will come from the pancreas. I mentioned the gallbladder already. It will come from the urinary bladder. So pain from the abdomen can come from any of the tissues in the abdomen. It will come from the abdominal wall, the walls of the abdominal wall. It will come from the lining the lining of the inside of the abdominal wall. This is called the peritoneum. Okay, so the pain. Normally, the site of the pain relates directly to the organ that is under it. So pain from the stomach will be localized to the left upper abdomen, the middle upper abdomen, or a little bit lower near the umbilicus. Pain from the stomach. So if you feel the pain in the upper abdomen, in the middle, the left side of the upper abdomen, or in the middle near towards the umbilicus, is likely coming from the stomach. If the pain is on the right side, upper abdomen on the right side, it will come from the liver, okay, or the gallbladder. The gallbladder sits beneath the liver. It will be coming from the ducts that supply that connect the liver to the gallbladder. That's the common bile duct, the left and right biliary ducts, or it will come from the cystic duct. Okay, it will come from it will come from pain from on the right side. It will come from the organs. Pain on the upper right side of the abdomen. Pain from the upper right side of the abdomen will come from the liver, the gallbladder, the ducts that link the liver to the gallbladder. That's the biliary ducts. The duct that leads the gallbladder to the duodenum. So those could be the sources of the pain in the upper right side of the abdomen. So the pain of the pain in the abdomen is usually directly related to the organ right underneath, that's the site of the pain. Now, so pain from the bladder will be felt in the lower abdomen beneath the umbilicus. Pain from the kidneys are felt at the back because the kidneys are retroperitoneal. They are at the back under the peritoneal lining. So they are felt at the back. The side is called the costophrenic angle. If you draw an angle between the ribs, the lower ribs, and the diaphragm, you make an angle between the lumbar spine and the diaphragm. that's the location where the renal pain is felt, pain from the kidney is felt. Okay. Now, pain from the intestines will be felt just above the site of the source of, just above the part of the intestine that's affected. But since the intestines are very mobile, and then and the fact that pain and something like an infection in the abdomen of the intestines, or let me go through this again. Pain from intestines is usually not very localized, okay, and it also vary in nature. If it's pain from intestinal spasm or strong contraction of the intestine, the pain could be felt. So the pain could be quite non-specific in its location. It would just be felt like a colic. Okay. Pain from the ureters. They are also felt. They are felt along a line from the upper part of the abdomen, that is going down, as if going down to the scrotum. So they are felt along the line. So it goes a ureteric stone. A ureteric stone will felt like that. That along the course of its travel, going from the upper abdomen, left or right, as if traveling towards the scrotum. So that's the direction of pain from the ureter. Okay, like from the ureteric stone. Now, pain from the uterus also is felt in the lower abdomen, the lower part of the abdomen, beneath the umbilicus. Okay, so that is it. So if you go by that principle that the pain in the abdomen is usually related to the organ under the part of the abdomen, you can now tell where the pain is coming from. Pain from the pancreas is felt similar to the pain from the stomach. It's felt the upper left part of the abdomen. Okay, so pain from the viscera themselves are not actually dull. So pain from an intestine that has a wound in it. Let's say like from a type of enteritis or from a tumor. Most tumors are actually painless. Most cancers are actually painless. Most cancers are actually painless unless they damage normal tissue. So pain from viscera actually dull pain. But when the pain reaches the peritoneum, the lining itself, which is very well innervated with nerves, and the pain becomes quite serious. The intensity of the pain increases because those viscera are not very well innervated with sensory neurons. But the lining of the abdomen and the lining of the chest are well innervated, like similar to so when the pathology gets to that tissue, the pain will be quite severe. All right, so that should answer the question. Doctor, what is causing my pain? Your pain could be coming from an ulcer in the stomach. Your pain could be coming from a gastritis, which is a gastric erosion. Your pain could come from a gastritis, a gastric erosion after you took painkillers. Your pain could be coming from the pancreas. Maybe you have acute pancreatitis from an obstructed pancreatic duct. The pain could be coming from a gallbladder, because of a gallstone or an infected gallbladder. The pain could be coming from the liver when you have a hepatitis, a viral hepatitis, or a tumor that has spread to the liver. Okay, the pain could be coming from your intestine because they are obstructed, and then now there's decreased activity, increased peristalsis, strong peristalsis trying to push through the obstruction and causing severe pain. The pain could be coming from inflammation of the intestines from infection, the virus or a bacteria. The pain could come from a fraction of tissue in the abdomen. Maybe you need a blood supply of a loop of intestine is cut off. Okay? Then you have pain just like anywhere else in the body. You have pain. You have the pain coming from the uterus, a fibroid in the uterus that's going in the blood supply and it's coming gangrenous and causing pain. The pain could be coming from the infected tubes, infected ovaries, and ovarian cyst that has twisted on his pedicle or ruptured. Okay, the pain could be coming from the pain could be coming from spasm in the rectum because of fecal impaction. The rectum becomes so hard and difficult to pass out, and it will pick on the rectum. So the pain will come from many places, even from urethra, the part of the urethra that's internal. Okay, so like the prostatic urethra, the pain will come from there. The pain will come from the prostate gland, which is just beneath the bladder. Okay, so that is the pain. If you know the site of the pain and you know the organ beneath that point, that's likely to be the source of the pain. That organ is likely to be the source of the pain. Thank you very much.